Hello friends, good morning. Today I am going to discuss about a scope of homeopathy in surgical conditions. What is conditions or in which conditions we use homeopathic medicines. Homeopathic medicine used before and after surgery has been found to protect the patient from shock, pains, bleeding, or other effects of surgical intervention, which minimize the suffering and deterioration of the health of a individual. Homeopathy is able to eliminate the unpleasant effects of anesthesia. Remaining consciousness after surgery, often nausea, vomiting, lack of appetite, dizziness, or headache. The homeopathic remedies bring quick relief in such cases. Even long term effects of anesthesia, like memory and orientation problem, personality changes, or depression, are successfully treated with the homeopathic medicines. Homeopathy consists Homeopathy considers the long-term diseases as due to deep constitutional weakness of the body that makes susceptible the individual or susceptible the individual for the frequent infections. Recurrent tonsillitis, chronic sinusitis, peptic ulcer, warts, cyst, fat growth, polyps, continuous formation of kidney stone or gallstone, venous thrombosis, varicose vein, hemorrhoids, ganglion, calcaneal spur, ovarian cyst, repeated tumor of the breast, cervical erosion, benign hyperplasia of prostate, fistulas, and such conditions are treatable with homeopathic medicine to the great extent or effort. Homeopathy considers that they are expression of our body about the internal derangements that we need to understand for correction. There are many conditions which have tendency to relapse, which are not surgical but in fact constitutional disorders. In such case, either constitutional medicine or prescribed for correction of the internal derangement or treated symptomatically to relieve the discomfort. In some other conditions, the surgical procedures might have removed the abscess, tumor, kidney stone, or gallstone, or other diseased part. This might have helped the patient to recover the immediate situation. Homeopathy considers this does not necessarily mean that the person is cured because the cause of the disturbance that leads to surgery was not corrected. In fact, the removal did not change the underlying pathological process that created them. In such conditions, people tend to get a recurrence of their ailments. Between the class of disease, between the class of diseases where surgery is inevitable and diseases that are manageable purely with medication, there lies a class of diseases known as so-called surgical diseases. These are the cases which are amenable to medical treatment. In these surgical disorders, homeopathy may be tried before resorting to surgical interventions. Homeopathy is also a very good option in condition where surgery is contraindicated but the patient need relief. In this way, we see in these three subsequent videos, number one, Hahnemann's teaching about surgical disease. Number two, concept of surgery in homeopathy. And third is a scope of homeopathy in surgical disorders. So, proper use of homeopathic medicine in indicated conditions, we remove the or minimize the suffering of the patient. I think this video will be helpful to practitioner students. Thank you for watching. Like, share and subscribe.